I'm Dr. Norm Shealy, and I am the founder and the CEO of the National Institute of Holistic Medicine, located in Springfield, Missouri. I'm a physician, a neurosurgeon, and my passion is helping people be healthy again. In 1963, when I finished my neurosurgical residency at Mass General Hospital, I realized that the standard procedure for treating chronic pain was really pretty seriously bad. We were cutting the front half of the spinal cord. It worked in 80% of people, a lot of complications, but within 4 years, only 8% of them were still free of pain. That's not very good. And I began to realize as I looked at what's happening that we're very good at acute care, and we're terrible often at chronic care. For instance, with depression, antidepressant drugs are totally ineffective. The best report is 42%, but that's with a 25% complication rate, including fatigue and sexual impotentia. Not very good. Antihypertension drugs, the best, at least somewhat under 50%, with chronic fatigue and loss of sexual power in men. Not very good. When it comes to coronary artery disease, coronary bypass surgery, well, within 1 year, somewhere between 25 and 42% of the people have failed. That is, it's closed off again. Those are not very good odds. So as I see it, in chronic disease, we need to look at the wide variety of safer alternatives. My passion is helping people and looking for safe alternatives. For instance, I think the best thing that I have discovered in my entire career is this little bottle here. When this is applied to 13 specific acupuncture points, it will relieve depression and anxiety in 80% of the people safely. There's not a drug in the world that can come close to that. I consider my major role to motivate the staff and the patients to keep going and do things that are acceptable and safe. I guess I would call myself the cheerleader. You know, basically it's rah, rah, this is what we can do, and look what we have done. He was sort of a father figure to me, and the chairman of medicine, Dr. Eugene Stead, was a great role model. Carl Moyer at Washington University was another one in surgery. There's been a number of wonderful people. Look for safety and look at all the possibilities, because drugs rarely are the answer. The nervous system is remarkably flexible, and I often talk about retraining the nervous system. You know, just as a child can learn to tie shoes and write and speak, we can learn to control the sensations in our body. We can learn to change our thoughts and our feelings and imprint new ones there. Basically, I have worked with 30,268 chronically depressed people, most of whom also had chronic pain. And our success rate of 85% cannot be beat anywhere that I know of in the world. So now we have put together a world-class expert in migraine, Dr. Roger Cady, a world-class cardiologist, Dr. Roy Heilbronn, Dr. Kent Dexter, who's worked with Dr. Cady for years, and myself, who's been an expert in both pain and depression management for 40 years. This is the way holistic medicine should be practiced today.